Drbeen, Sayyed from Drbeen.com. Welcome to one more show. So today's talk is probably not a surprise to many, but it will be to some as well. And that is that in some countries, SARS-CoV-2 was present before even the pandemic was declared, or even before China had declared that we have um, a pneumonia-like illness going. That was December of 2019. So some countries had the SARS-CoV-2 antibodies proven before that, which then had started another conversation of saying, where is the origin? Was the origin China or some other country? Here we're going to talk primarily about Italy today. There have been other studies later on as well that have looked at all this data, and they still came back and said that origin is in China. So let's look at this study, interesting study, that there were antibody positive patients, asymptomatic, before the declaration of pandemic, and even new patients with, or persons with, neutralizing antibodies before the pandemic. So let's look at that. So these are the gifts for humanity, and let's go over the references first. This is Drbeen.com. In the description, you have a link that is such a low price for Drbeen.com that if each one video is not worth that price, you can ask the price to be refunded. So this is just for the YouTube for some time. So please take advantage of that if you would like to. Here is the discussion. Unexpected detection of SARS-CoV-2 antibodies in the pre-pandemic period in Italy. And this is Tumori 2021 October. Then this is another article on it. Here is an article which I really liked. This is Reuters article about this, and I thought they did a good job. Global Times, WHO looked into this as well to see if the origin was in Italy or some other country. This is another good article here. Could the new coronavirus have infected humans prior to November 2019? And then this one, COVID-19 and China. I really love this one. Everycrsreport.com. Again, I have no idea if these are politically leaning sites or not, but I looked at this. We all have gone through this pandemic together. So many of these dates here, they seemed fine to me. So it is interesting to look at the chronological events of the pandemic. So with this, let's start our discussion. I'm going to structure the discussion into two parts. One, I'm going to go over the summary and then we'll stop. And then the second part will be, I'll go over the site and we'll discuss more in detail that what kind of antibodies, in what number of people, and what regions. So hold on to that. Here is a summary coming now. So I have no disclosures. This is one of my paintings. We are right now in the Omicron BA2 era. Medical disclaimer, this is not an advice. This is Italy, and we're going to talk about Italy today. This is my attempt at making medieval Italian dress. So here is how the discussion is. Number one, these persons who tested positive were asymptomatic when they got infected and recovered. So that's one. Keep in mind, asymptomatic. And this kind of makes me wonder, were there symptomatic patients as well? Were there patients that were meeting this horrible situation of ending up in the hospitals and dying, and the countries or healthcares did not know? Or was it just milder before, and then after the pandemic's declarations, it became bad? So anyways, these folks that we're going to talk about, 111, they were all asymptomatic. Second part, Italian healthy volunteers participating in lung cancer research. So there were people who were healthy, who were participating in a lung cancer research, which was a prospective research. That means they will be observed in the future to see if any of them has a propensity towards lung cancer and why. So they were healthy. And the enrollment was from September of 2019 till March of 2020. As part of their enrollment, they had given their blood samples. These are the blood samples that were looked at afterwards, and they found antibodies in them, even as early as September. So if they found the antibodies, let's say in January or February of 2020, then yeah, that's fine. Pandemic was raging by that time. And so you could say that it is okay to find these antibodies. But finding antibodies in September, when China declared it in December, and the pandemic was acknowledged by WHO in March. So at least December. So here we're talking September. So these healthy individuals were participating in a different type of a trial, but their blood was present. And so, with their consent, researchers went back to their blood samples and looked at the antibodies for SARS-CoV-2. This is what is interesting. They found the very first sample of IgM. And I would explain later in the detail that IgM means a fresh infection. And it could be anywhere from 3 days to 5, 7, 8, 10 days. Usually between 5 days is the median time. So if I get infected or exposed today, within 5 days, I would start making IgM. IgM antibody is a sign of an early fresh infection. So on September 3rd, a patient who had given their blood on September 3rd, that patient's blood had IgM. And remember, this study only includes people from September onwards. I don't know what would have happened if they had included people before September. And I would show you a couple of other studies where it seemed like even before September, in autumn or even in spring of 2019, some countries had a possibility of the infection there. Now, it showed that 4 cases dated back to the first week of October. Now, what is the difference? Why are we talking about September versus October here? September cases had antibodies, IgM. October cases, remember October, we're talking about pandemic starting officially in December and acknowledged in March. But here there are 4 patients in October who had neutralizing antibodies to SARS-CoV-2. So not only they had antibodies, they had viable neutralizing antibodies. And in October, much before the pandemic's official dates. So these were also positive for antibodies neutralizing the virus, meaning they had got infected in September. Giovanni Apollone, a co-author of the study, told Reuters. And that is what, according to the researchers, they said this is the main finding. People with no symptoms not only were positive after the serological tests, but had also antibodies able to kill the virus, and much before the pandemic. That's interesting, actually. Now, some dates. And I try to make this thing as Earth, which is grabbed by the virus, but somehow it doesn't even look like an Earth. It looks like a peanut of some sort. And then this just looks like a hug. So use your mind's eye and think this is Earth, and there is a virus kind of grabbing it. Okay, so interesting dates. Check this out. First IgM positive in Italy, September 3. That doesn't mean that Italy had it only in September. If they may have gone to the dates before, they may have found it then too. These sample sets started from September. So first IgM positive, September 3. And this is only 111 out of 959. So it's not a huge sample that you could say, well, we can conclusively say it only started in September over there. It may have been earlier. But in this study, September 3rd, then first neutralizing antibodies detected, October 7. This all is happening before the dates. Then we know that January 4th is when WHO, end of December is when China went to WHO and said, hey, we've gotten a problem. And then WHO on 4th, they tweeted, China has reported to WHO a cluster of pneumonia cases with no deaths in Wuhan, Hubei province. January 30, first COVID positive patient in Italy. So what I did was I went over the research paper and pulled various dates littered around in the paper and put them in one place. I inserted these WHO dates separately. So first COVID positive patient, officially COVID positive patient, they were actually two on January 30, end of January in 2020. Well, they had the antibody positive in September. First COVID positive Italian patient. So these two on January 30, they were actually Chinese tourists for Rome and they tested positive. Then in February 20th, first COVID positive Italian patient who did not have a history of contact with other COVID positive folks abroad or with tourists. So, how did this person get it? Possibly because the infection was percolating in the society at a lower level, and so he got it from someone else. National level lockdown in Italy was March 8th, and that I think coincided with the WHO's announcement. And then that in Europe or in the West, Italy was one of the early countries which got badly uh, impacted, although then US just broke all records, unfortunately. So national level lockdown, March 8th. WHO declares pandemic March 2020. So this is how interesting it is. We would have expected that at least the spread occurred after China said in December's end that, hey, we've gotten something, we are not very comfortable about it, and here it is. So it must be traveling to other countries by December and January, February, but here we are looking at September. So authors note, because they're finding unexpectedly antibodies in the blood, this study shows an unexpected, very early circulation of SARS-CoV-2 among asymptomatic individuals in Italy several months before the first patient was identified. This should raise a question in our head, and that is, why were they all asymptomatic? Or if they were all asymptomatic, again, they are 111 out of 959 patients who were participating in this trial. If they were all asymptomatic, were they symptomatic as well? Or did the virus actually evolve and became more severe afterwards? So, before the first patient was identified, and clarifies the onset and spread of the coronavirus disease 2019 pandemic. Findings: SARS-CoV-2 antibodies in asymptomatic people before the COVID-19 outbreak in Italy may reshape the history of pandemic. So that is interesting. And as I'm seeing here in the comments as well, that some folks are saying, hey, I had bad respiratory virus in January 2020. Wozniak, Apple's co-founder, had said that he felt he had this in January 2020. There are societies that said wastewater had the RNA for the SARS-CoV-2 in summer time frame. We saw that WHO saw increased traffic to the uh, Chinese hospitals in Wuhan much earlier than December. Similarly, France had patients in December. Similarly, there are some countries where the patients were present in fall time frame. So there is actually a need for a deeper analysis, and we all know that analysis is hampered, and a general analysis that no, this is it, this is when it started, is done and closed. But there needs to be a deeper dive to understand, when did it happen, how did it start, was it actually milder before, asymptomatic, really nothing, and did it then become severe? How did it become severe? Or was it severe before as well, and we just, doctors did not know it is SARS-CoV-2 and thought this is just bad pneumonia and killing people? That all needs to come together. So more studies. In this study by the authors, they refer to more. For example, they say in France in December 2019, there was a person who was tested positive to SARS-CoV-2. So you could say, well, there was no test for SARS-CoV-2 at that time. So this was a person in December 2019 in France who was admitted to a hospital for respiratory disease, and their swab, his or her swab, was present in the hospital. So they later on, after the pandemic declaration and the testing, they later on went and retested that person's swab, and they found that to be positive for SARS-CoV-2. Then Harvard, our Harvard here in the US, Harvard did a study that showed an increase in hospital traffic and an increase in online search traffic for the respiratory symptoms like COVID-19 since autumn of 2019, September, at least from the US point of view, September. And there are countries that said even spring. So my notes. This is the summary. This is the end of the summary, and then we'll actually do a deeper dive as well. This is the end of the summary part. Mubin's notes. Maybe the virus was out there even before September. So just not the September, but before that. And I think there are many, many clues. This study includes reviewing blood samples collected from September onwards. What if the samples were earlier than September? Secondly, IgM on September can mean infection earlier. So if I go to my drawing board for a second, then we know that when a person is exposed, let's say here is a person exposed, we then know that there is an incubation period, correct? After the incubation period, then there are symptoms. And that used to be with Wuhan variant, that was about 5 days, 5.1 days was the median time for symptoms. Then the symptoms would ideally, in most cases, would resolve in 5 to 10 to 13 days. There were outliers even up to 29 days, and then the infection would finish. And what will happen is that the antibodies, after the exposure, 2-3 days later, antibodies are supposed to start becoming made. And as the antibody levels would increase, the symptoms and the viral load would reduce. So you would expect somewhere about 5 days and onwards, antibodies would increase. And then they would go down. First IgM normally, then IgG. But in case of SARS-CoV-2, we saw that IgM and IgG, they both get produced and go up together. But then IgG continues for more time, while IgM declines within a month or so. So if somebody has positive IgM, let's say September 3rd, then that means that their actual infection may be a few days before. So it's not that they had it started on September 3rd, must be somewhere in August. And again, I keep repeating it. They have blood samples only from September. What if they had samples from August or September or before July? Maybe they would actually find antibodies before that too. So that's one. Why were these patients asymptomatic? That is a very interesting thing for me. And that is, here is how we saw when the pandemic started. So let's say December, end of December is when we started having this inkling that there is a problem. And WHO started saying, hey, we're not very much worried, and we're not banning any travels, and caution and whatever. And then by March, WHO said, you know what, we have a problem, and here is a pandemic. And we saw that with this, there was a lot of destruction of human life, and there was a lot of misery, and there were hospitalizations and numbers going up, and John Hopkins dashboard and other dashboards came up, and we were looking at the disease and the damage by the disease. But what is interesting for me is, before this time, in some countries and communities, this virus was present. If they were also having similarly bad outcomes, somebody would have said that, hey, what is going on? What kind of pneumonia have we gotten that is so bad? But that in other societies, we don't hear that. Yes, from Wuhan in December, although it started earlier in December in Wuhan, but at least near the end of December, they started saying, we have a problem and that problem is causing destruction. The same virus before was not causing destruction, or it was causing it, but we are not able to collect that data. But the way we saw the misery and the scare, if this was happening before, then more than Wuhan would be saying, hey, this was happening. But interestingly, China, Wuhan was the first folks who said there is a problem. Now, did the virus actually convert from a more mild, or just like Omicron, if from a milder state to a more severe state, did it evolve? What happened here is interesting for me. What happened in that time frame? So my comment here, why were these patients asymptomatic? Were there symptomatic patients, or was coronavirus less aggressive in the early days? And so now we are done with the basic summary. The summary is, test was done. There were some people taking part in the lung cancer study, and 959 of them, 111 whose samples were tested afterwards, they tested positive for the antibodies. Majority of them in Lombardy region. Lombardy region in Italy is where the actual then hotspot also occurred. And first case of positive antibodies September 3rd, first cases of neutralizing positive antibodies October 7th. The rest is history. So this is the discussion. I'm now going to go into the detail. So if you want to stay on, welcome. If you want to leave after this summary, totally up to you. I have these interesting questions. So if you have some thoughts about it, I would love to hear it. Now let's look at the paper and the data. So again, I'm going to be quick about this. Here is what is the detail. Number one, the testing that they did, they have a proprietary test for receptor binding domain of SARS-CoV-2. It's a pretty robust test. They talk about it later in the paper. 959 asymptomatic individuals, and 111 of them tested positive afterwards, and that is 11.6%. Starting from September, so 14% of these folks in September had the antibodies. Majority of these folks who had antibodies were from Lombardy region. So imagine September 2019, Italy, Lombardy region had already percolating SARS-CoV-2 in the society. Now, their first case, so Italy's cases of COVID-19 disease were recorded on January 13, first two cases, and these were the tourists from China who came in to visit Rome. The first laboratory positive Italian case was February 20. And that person did not have any history of coming in contact with foreigners or have traveled abroad. So he must have caught it from within the society. And I talked about the lockdowns. So it was hypothesized that the virus had been circulating in Italy since January. And here the researchers are showing that the virus was actually present September or even before that. The arrival of the virus and its circulation in Italy in a less symptomatic form could be anticipated by several months. And then they did the serological assay. I would like to go over this table. They have actually given a table of how many patients had IgM. IgM will mean fresh infection. How many had IgG? That means a little late in infection or even quite late in infection, where IgG is staying on as a protective antibody for some time. And how many patients had IgG and IgM together? So they had this hypothesis. They had these folks who were participating in SMILE, they had 959, and they started looking at them. Here is what they saw. In summary, 397 patients were women in this SMILE lung cancer study. 63.2% were 55 to 65 years of age. So it's interesting that the age range was such that severe cases would have been seen, but they saw asymptomatic cases. Again, we can give this flexibility here to say maybe they were an equivalently larger number of folks who were in severe cases, not equivalent, but let's say 2% of these. So, 2 out of 111, or in addition to these 111, maybe there were 2 or 3 more who were in hospitals and were becoming severe and they did not notice. Ideally, in the beginning, with the Wuhan variant, the situation was out of every 100 people, 20 will end up in the ICU and 3 to 5 would die. So if we take 111 asymptomatic patients, we actually do not have any data to say for how many asymptomatic patients are they symptomatic patients. We know that out of 100 symptomatic, 20 end up in the ICU. But how, if there were 111 asymptomatic, then how many symptomatic were there? Don't know. So that's a very interesting data point. The point I'm trying to make is, was the virus as severe, or did it become severe in December? So overall, 111 of 959, 11.6% plasma samples showed SARS-CoV-2 RBD specific IgM or IgG. In particular, IgM antibodies were detected in 97, 10%. IgG were in 16 or 1.7. All the patients were asymptomatic. And then this data, we already saw that. They have actually very interestingly given some patients exact dates. For example, look at this. First 2 months, September, October 2019, 23 of 162, 14.2% patients in September, and 27 of 166, 16.3% of the patients in October. So out of 111, then they had these 100, not out of 111, they had 162, and for them, 23 in October and 27, 23 in September and 27 in October. They had IgG and IgM. The first positive sample was recorded on September 3 in the Veneto region, followed by a case in Emilia Romagna, September 4, and then a case in Liguria, I hope I'm pronouncing this correctly, September 5, and so on. So you can read that. By the end of September 13, of the 23, 56.5% positive samples were recorded in Lombardy, 3 in Veneto, 2 in Piedmont, and 1 each in Emilia Romagna and Liguria, Lazio, and Campania and Friulia. So here, I want to go here. I cannot pronounce the names correctly. So check this out. Table 1. Severe acute respiratory syndrome receptor binding domain antibodies. So these are antibodies. Total 959 patients. 16 had IgG, IgM in 97, and IgG and or IgM 111. Then look at this, September, 162 patients, 3 had IgG, 20 had IgM, 23 total IgG or IgM, and so on. October 166, 4 and 23, November 3 and 23. So these patients, September, October, November, even I would say December, were actually supposed to be much before the China's declaration that we have some problem, and then going into 2020. Then they had January 3 and then February 21. This another interesting thing they noticed was, if you see here the red lines, there were 2 peaks of SARS-CoV-2. They were already seeing peaks. So there is one peak here that was from September week 1 till December week 2. There was already a tiny peak. And then the second peak appeared in January week 3 and then went up and went till February. Can you imagine? So we are used to the peaks as well, right? They had these 2 tiny peaks observed too. So frequency of immunoglobulin M and IgG receptor binding domain positive cases in respect to total number of screening participants. So that I thought was very interesting. This is the various regions where the percentage of folks were present, patients. This is interesting that evaluation of anti-SARS-CoV-2 functional neutralizing antibodies, so they were working neutralizing antibodies, was performed for all 111 SARS-CoV-2 RBD positive samples using a cytopathic effect-based live virus microneutralization assay in a high contaminated containment biosafety level 2 lab. 6 of the 111 SARS-CoV-2 patients were positive in the qualitative CPE based microneutralization test. So they had, and these 6 are, many of them are in October. So that's interesting. At the end of December, then they're talking about that China came out and they said, hey, we've gotten a problem. And then Italy had these cases. I've already discussed them. So then they talk about what is the important thing to note here. Two phenomena need to be highlighted and discussed. The first concerns the underestimation of the prevalence of the cases. They're saying that if we are seeing in 959 people, 111 already having the antibodies, then the actual prevalence of the virus must be larger than the counts that we have. Because we were counting, we meaning global community, were counting cases and counting cases afterwards, after December. Then they say, as a consequence, an underestimation of overall COVID 19 cases was created and a selection bias was introduced with an overestimation of the mortality rate. So now they're saying that if you're only counting cases and you have mortality counted with the cases, so let's say out of 103 people, they're saying it is possible that for each 100, there were another, and I'm making up this number, there were another 200 that were asymptomatic. So maybe the 3 deaths are actually out of 300 people who get infected. 200 remain asymptomatic, 100 become ill, then 3 out of them die. So that is their point, that it is possible that the case rate, case fatality rates are not correctly counted. Or there is a selection bias. We're looking at known elements. Then they say well-designed sero surveys in selected subpopulation with specific risk groups have provided valuable epidemiologic information. So then they talk more about various regions. They talk about this here. Between May 25 and July 15, the Italian ministry, what is interesting here is that they said we had another study that showed the sero prevalence to be 4.6%. Then between May and July, Italian Ministry of Health accomplished a large SARS-CoV-2 seroprevalence study, and they said it was 2.5%. So as a consequence, the true number of Italians who had been in contact with the virus would be approximately 1.5 million, many of whom were asymptomatic and estimated almost 5 times higher than the official figures. So that is interesting. So this is one. Their one concern is that not knowing these seroprevalences makes us undercount the overall cases and overcount the percentage of the people dying. The second concern is onset of epidemic, which is likely to have preceded the identification of the first case probably in the last part of 2019. So since November, December 2019, many general practitioners began reporting the appearance of severe respiratory symptoms in elderly and frail people. So this is that discussion. I already went over this, that they'll talk about France having a case, Harvard finding cases as well. So an international level, concordant evidence comes from 2 additional studies, and these are the ones I just discussed, France and Harvard. To our knowledge, there are no published data on antibody responses to SARS-CoV-2 in the pre-pandemic period in any countries in the world Our study was carried out in a sample of asymptomatic individuals originating from all Italian regions. So, this is the basic discussion. Their final discussion is that our results indicate that SARS-CoV-2 circulated in Italy earlier than the first official COVID-19 cases were diagnosed in Lombardy, even long before the first official report from Chinese authorities, casting new light on the onset and spread of the COVID-19. That is the case. So for me, that other than yes, this seems to be, there is a, where was it, when did it start, which societies had it. The question is, there were societies that had it from summer onwards of 2019. Why was it not that severe? So that is my question, and that is the discussion for today. Thank you very much. Uh, Take advantage of that link in the description for YouTube. That is a premium content on Drbeen. There is a link in the description. Price is really, really cheap. I don't want to call it cheap. It's a gift. It's inexpensive. There are other links in there as well. You can become a patron, or you can buy me a coffee, or you can use PayPal. With this, please like, subscribe, and share. And I would see you in a few minutes here on YouTube in Chit Chat, because the Rumble and Odyssey Chit Chat is still a challenge. So I'm going to come back here in a few minutes and we'll continue. Thank you and see you later. Bye.